This medication, We Care, is a type of iron supplement that is used to address low levels of iron in the blood, which can occur due to conditions like anemia or pregnancy. Iron is essential for the body to produce red blood cells and maintain overall health. It is important to take We Care regularly to ensure that the body has an adequate supply of iron. The recommended daily dosage for adults is typically 18 to 27 milligrams, and it is best to take it on an empty stomach to maximize absorption. If you experience any side effects or have concerns about taking We Care, consult with your healthcare provider for personalized advice. It's important to follow the directions on the product package or as directed by your doctor. Avoid taking more than the recommended dosage, and if you have any questions, consult your doctor or pharmacist. For best absorption, take iron on an empty stomach, usually 1 hour before or 2 hours after meals. If you experience stomach upset, you can take this medication with food. Avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after this medication, as it can decrease its effectiveness. When taking tablets or capsules, swallow them with a full glass of water unless directed otherwise. Do not lie down for at least 10 minutes after taking your dose. Swallow extended-release capsules whole and do not crush or chew them. The same goes for extended-release tablets. If you are taking chewable tablets, chew thoroughly before swallowing. If you are taking the liquid suspension form, shake the bottle well before each dose. And if you are using the liquid drops for infants or children, carefully measure the dose using the dropper provided. You can mix the dose in formula, fruit juice, cereal, or other food as directed, and it's best to give this medication right after a meal. Remember to take this medication regularly at the same time each day in order to get the most benefit from it. If you experience constipation, diarrhea, stomach cramps, or upset stomach, these effects are usually temporary and may go away as your body adjusts to We Care. If these effects persist or worsen, contact your doctor or pharmacist. We Care may cause your stools to turn black, which is not harmful. If your doctor has prescribed this medication, they have determined that the benefits outweigh the risks of side effects. Many people using We Care do not experience serious side effects. A very serious allergic reaction to We Care is rare, but seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects, contact your doctor or pharmacist. In the US, call your doctor for medical advice about side effects. You can also report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You can also report side effects to Health Canada at 1-866-234-2345. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. Keep this product out of reach of children. If overdose does occur, get medical help right away or call a poison control center. It's important to keep We Care out of reach of children, as accidental overdose of iron-containing products can be fatal for children under 6 years old. If an overdose does occur, it's crucial to seek medical help immediately or call a poison control center. Always take the recommended dosage and store the medication in a safe place. Remember, safety first. Before you start taking We Care, make sure to let your doctor or pharmacist know if you have any allergies to it or any other medications. This product may contain inactive ingredients that could cause allergic reactions, so it's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have iron overload disorder, alcohol use or abuse, liver problems, or stomach/intestinal problems. If your iron supplement also contains folic acid, let your doctor or pharmacist know if you have a vitamin B12 deficiency before taking it. Folic acid could falsely improve certain lab tests for vitamin B12 deficiency without actually treating the anemia, which could lead to serious nerve problems. Consult your doctor or pharmacist for more details. If you're considering the chewable tablets of this medicine, keep in mind that they may contain aspartame. If you have phenylketonuria or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist about using this drug safely. And if you're looking at the liquid preparations of this product, be aware that they may contain sugar and/or alcohol. It's important to use caution if you have diabetes, alcohol dependence, or liver disease. Ask your doctor or pharmacist about using this product safely. For pregnant women, We Care should only be used when clearly needed, so be sure to discuss the risks and benefits with your doctor. And if you're breastfeeding, consult your doctor before using this medication. When taking We Care, it's important to be aware of potential drug interactions. This product can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's best to separate your doses of these medications from your doses of We Care. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. It's also important to avoid taking this medication at the same time as antacids. Wait at least 2 hours between taking this medication and an antacid. If your brand of iron also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. Lastly, this medication may interfere with certain lab tests, so make sure lab personnel and all your doctors know you use this drug. If someone takes too much We Care and has serious symptoms such as passing out or trouble breathing, it's important to call 911 for help. Otherwise, it's important to call a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. Always follow the recommended dosage to avoid these symptoms. If your doctor has prescribed We Care, do not share it with others. Your doctor may also recommend lab and/or medical tests while you are taking this product, such as a complete blood count. It's important to keep all medical and lab appointments and consult your doctor for more details. We Care is not a substitute for a proper diet, so it's important to maintain a well-balanced diet. Foods rich in iron, such as red meats, especially liver, fish, beans, dried fruit, and iron-fortified/enriched cereals and bread, can help support the benefits of We Care. If you are using We Care on a regular schedule and accidentally miss a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. When storing We Care, make sure to keep it at room temperature and away from light and moisture. If you have the liquid form, do not freeze it, and avoid storing it in the bathroom. Always keep all medications out of reach of children and pets. When it comes to disposing of We Care, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. It's important to properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.